But where do things stand when it comes to testing? How many Virginians are checking for COVID symptoms and getting swabbed?
Alex Littlehales takes a look and explains how much changed since last year.
Past month, we have seen an increase in testing, which is good.
Testing is still considered the eyes and ears of the pandemic.
Hey, okay, so I am looking for a rapid test.
Data shows that every day more and more Virginians want to know whether they're positive or negative with COVID-19.
But the good news is we're seeing a greater access to testing now.
And this is a negative rapid test, and the Virginia Department of Health says that testing has roughly doubled in recent weeks.
VDH is getting reports of roughly about 20 to 22,000-ish tests per day.
20 to 22,000 tests per day, including both rapid and standard PCR tests. It's an increase seen statewide and in Hampton Roads in cities like Chesapeake.
With the increased testing, we are happy that there's an increased awareness out there. Well, just here in the Chesapeake area in the past month or so, we've seen the testing in the hundreds.
Jerry Tucker, Chesapeake's public health emergency manager, says testing is still a fraction of its peak when the city saw around 1,000 tests per day. But health leaders like Tucker say the recent surge of testing is a positive thing. It helps them better understand how much is in the community.
What I don't want to see is people just completely rely on testing alone and not consider the vaccine, because the vaccine is really what's going to be the long pole in the tent.
The VDH tells 13 News Now that COVID testing hit a low for the state of Virginia this summer at around 10,000 tests per day. In Chesapeake, I'm Alex Littlehales, 13 News Now.
Virginia's positivity rate of coronavirus tests has steadily increased since mid-June.